Hey, it's Dr. Dinky at Select Spine and Sports Medicine. Today, we're going to talk about the most evidence-based way to treat tennis elbow. So pain on the outside of the elbow, commonly called tennis elbow, is the most common elbow complaint. This comes from an overextension of the wrist, which actually moves the muscles and tendons in the elbow. So most recently, in 2018, the Journal for Orthopedic Surgery has said that the #1 stretch for lateral epicondylitis is elbow extension, forearm pronation, and wrist flexion. So we highly recommend this stretch if you have pain on the outside of the elbow here. Now, one thing you can do is actually push your hand this way into this hand. So push, 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 good, and then relax. And then you stretch that a little bit further, and then you repeat that. Now, a study in 2014 said that eccentric stretching or eccentric contraction is also a great exercise for lateral epicondylitis. So for this, we use the TheraBand Flex Bar here, okay? What you do is you grab and twist, extend, and then you let that wrist roll down, and that really gives a nice stretch there. Bring it back in, twist, back out, and let it pull and unroll and stretch the lateral part of the elbow there. Now, other conservative methods, spinal manipulation to the neck and upper back has also showed to decrease pain in the upper extremity, as well as manipulation to the elbow and wrist have also showed to, #1, decrease pain, increase range of motion, and increase pain-free grip, because I know gripping cup, shaking hands, and also for you weightlifters, gripping the bar is killing that elbow. So those are great treatment options as well. Another thing that we do here in the office is called instrument-assisted soft tissue mobilization. Now, it's important to note that in these tendonitis, when you have inflammation in the beginning stages of this injury, causes pain, but over time, it becomes what's called tendinosis, which is a breakdown of the tendon without the inflammation part. So in order to get better, your body actually needs inflammation. So we use instruments. I'm going to show you a video here, instrument-assisted soft tissue mobilization, to work the muscles and tendons to actually increase the inflammation by causing slight micro trauma to that area, which helps to spark the healing process. There's also kind of a scarring or a breakdown effect, whereas these instruments aid us in helping to mobilize that scar tissue and increase the pliability of those soft tissues in that area, again, to help spark that healing process. So these are the most up-to-date methods in treating lateral epicondylitis or tennis elbow: strengthening, eccentric contraction, manipulation to the neck, upper back, elbow, and wrist, as well as soft tissue mobilization using instruments to increase the inflammation area by microtrauma. If you've got any questions about this, or you've been dealing with tennis elbow, let me know in the comments how long you've been dealing with it, because, little tip here, recent study shows that using these instrument-assisted soft tissue mobilization techniques actually allows for a speed up in the healing process, whereas 60%, almost 60% of patients recovered within 1 month of this treatment method, and almost 80% were fully recovered in about 2 months. So if you've been dealing with this is something that you need help with, then seek a provider like us at Select Spine and Sports Medicine that provides all of these services under one location. Thanks for watching. We'll see you soon.